Today, we are going to be looking at the effects of opioid use in today's world. Do you want to look like this? Stop. Say no when you are offered this. While most of us may not think it will happen to you, at some point in your life you will maybe offer the chance to try drugs. Whether you're walking on the street or at a party with friends, some people will make the decision to harm their bodies with drugs. Some of the most dangerous drugs, or hard drugs, belong to the opioid family. Some of these drugs we don't even realize are drugs because they can be administered in hospitals as pain relievers. This is what gets people hooked. People enjoy the absences of pain after a surgery or procedure and want to continue this enjoyable feeling every day. They continue to take these pain relievers in their daily lives to complete everyday tasks and end up creating dependency to live on these hardcore drugs. Opioids trick the body by releasing dopamine and blocking pain receptors when you take them, which gives you a good or euphoric feeling. Some examples of these include morphine, heroin, oxycodone, hydrocodone, and fentanyl. Some short-term effects of opioid use include sleepiness, relaxation, euphoria, nausea, vomiting, and constipation. The short-term pleasure is not worth the long-term pain you will cause yourself in your everyday life. Opioids can have all types of negative health-term effects, as well as including ruining relationships, struggles within one's work life, hypoxia, coma, permanent brain damage, and death. When taken, opioids can slow your breathing and cause depleted oxygen supply to the brain, which is known as hypoxia, which can cause the other effects listed previously. Even under a doctor's watch, people can become addicted to opioids due to prescription doses being increased and a person becoming more tolerant to the drugs. This is a video to help explain the difference of how opioid use has evolved in today's world.
Addiction is changing. What once seemed relegated to desperate souls hiding in the shadows now impacts our friends, families, and co-workers. More people are addicted to opioid painkillers than ever before.
I believe that over the past 20 years, definitely, the indications and the setting in which opioids are provided has changed dramatically.
Mayo Clinic pain management specialist Dr. Michael Hooten says that's good and bad. People are able to get relief from severe pain, but they're also able to get prescriptions for opioids when less addictive options, such as ibuprofen, may work just as well.
If they are predisposed to develop addiction, either neurobiologically or from a behavioral perspective, then all of a sudden we are selecting this group of individuals who may go on to have long-term problems.
Dr. Hooten says educating people about the dangers of opioid misuse may be an important step in managing this public health crisis. For the Mayo Clinic News Network, I'm Vivian Williams.
When it comes to work and family life, opioid use can have a detrimental effect. When people begin to use drugs, it is hard for them to think about anything else besides those drugs and how they make them feel in the short term. Misuse of these drugs leads to addiction or a substance abuse disorder, which develops when continued misuse of the drug changes the brain and causes health problems and failure to meet responsibilities at work, school, or home. This can happen to anyone, and it completely controls you. You begin to neglect your responsibilities and put your family on a back burner and change around your life to continue using. These people begin to show up to work and family functions high, and people start to ask questions and talk about you. There are other more healthy ways to get rid of the pain and feel good, and drugs isn't it. This is a brief video overviewing a retired veteran with his story with opioid addiction. His name is Britton, and this is his story of how he struggled with opioid addiction and how he overcame it.
One day you're serving in the military, you come home and you're dealing with an injury. My opioid misuse and need got so strong. Addiction is hard. You have to reach out for help. The recovery side of it is amazing. You get to a place where you're proud of yourself again.
If you or someone you know is struggling, there is hope. Recovery is.
When people come out of the military, they have trauma and flashbacks from the battlefield, and some turn to drugs to mask the pain. This helps to show it can really happen to anyone, even if you don't think it will happen to you. All it takes is one-time use, and you could be hooked. A person's motivation to use a substance erodes social ties over time as they begin to miss social obligations, behave in secrecy to obtain or use a substance, or become less invested in relationships that exist outside of the drug use sphere. People who use become isolated and feel like they have nobody. They begin to cut out the people in their life that care for them the most and ruin the best relationships in their life. They stay in and stay to themselves, which isn't necessarily a bad thing, but avoid social situations as they want to continue using drugs and feel like they don't fit in with everybody who doesn't use. When comparing risk among those who report single drug use, there's an increased risk of suicide among those who only use opioids when compared to people who report single drug use of other drugs, demonstrating plausibility of a specific link between opioid use and suicide. Not only do drugs in general isolate you from the general population, but opioids also specifically mess with your brain chemistry more than most drugs do. When you can't get that same rush of dopamine from these drugs, your real feelings start to kick in, and many become depressed and have a much higher risk of suicide. Increasing numbers of depression, diagnoses, and suicide rates also make the topic a touchy one, and you're actively increasing your chances of harming yourself or others by taking opioids, especially over a long period of time. As briefly touched on before, opioid addiction can start from simple prescription opioids used to treat pain relief and help recover from injury. When these drugs aren't strong enough and don't deliver the euphoric feeling as they once did, people start moving up to stronger drugs like heroin and fentanyl. According to John Hopkins University, about 75% of people in the US who became addicted to street opioids, such as heroin, during the 2000s report they started out taking prescription opioid drugs. Looking at this number is insane because there are prescription drugs that sometimes you don't need to be prescribed, and ibuprofen would work just as well. Something you are recommended to take from a doctor as needed can turn into an ugly addiction which can ultimately ruin your life without a kind of help. When someone becomes addicted, their life revolves around the drug, and they think there's no way of coming back from it. This is not the case. There are medications for opioid use disorders that are safe, effective, and save lives. Some of these medications include methadone, which activates receptors to ease withdrawal symptoms and cravings, buprenorphine, which attaches to and partially activates opioid receptors to ease withdrawal symptoms and cravings, and naltrexone, which prevents opioids from attaching to opioid receptors, thus blocking their effects. Just because somebody has become addicted to drugs doesn't mean there isn't a way back, and this has to be their life forever. These people still have family and friends that care about them and want to help them out of the situation. The help can only start if they speak out and want the help. You can't help someone who keeps going back and harming their body, even though they persist on wanting help. You can try so hard to help, but sometimes people don't want the help, and you can only do so much, and that's the hard truth. It starts with the addicted admitting they have a problem, then family and friends around them will typically help them through the hard stage of their life. The other hard truth is that sometimes families will completely cut out their loved ones if they start drugs. Even if they come back from the addiction, it's hard to mend those relationships and the pain you put those people through. It's terrible to see, but some people who start using don't have the same support system to quit, and they lose everything, so the drugs is all they have to lean on. We're going to look at a video on how to deal with prescription opioid addiction and to help encourage people to look for treatments, not avoid them.
Hi, my name is Pete, and I'm a postdoctoral researcher at the National Institutes of Health. Over 2 million people in the US are addicted to opioids, a condition also called opioid use disorder. This means that they can't stop using certain pain medications or dangerous drugs like heroin or fentanyl without experiencing severe physical and psychological effects. And although there are medications like methadone that are much safer and can help those people stop using opioids, the vast majority of them don't take advantage of those treatments because of the way others might judge them for doing so. Some people incorrectly think that those treatments just substitute one drug for another, which isn't true. But that view persists because people don't understand how medications for opioid use disorder work and how they're different from opioid drugs like heroin. In my research, I perform brain scans to look at how brain chemistry changes when people take medications designed to help them stop using opioids. These scans measure dopamine, a chemical in the brain that helps us learn when something is rewarding, like eating chocolate cake. However, opioid drugs hijack the dopamine system and can mess with the normal balance of the chemical in our brains. My goal is to find evidence that a person's brain chemistry can get back to a healthy, normal state after taking medication for opioid addiction. In this way, I can help to change societal attitudes about those medications by showing that treatments for opioid use disorder can buy the brain time to heal and lower risk for the many health problems associated with opioid addiction. I hope that changing the way people think about those treatments encourages more people to get the help they need to stop using opioids.
Now, we are going to look at another brief story from a woman named Joy to help show those who have become addicted that you can recover and help guide people toward the right choice of quitting and getting the help they need, not only for yourself, but also for the people around you that you love.
The first time I tried heroin, not only did I like it, I loved it. And it just gave me a sense of peace that I didn't have to worry about stuff anymore. I just wanted to be free of worrying about stuff all the time. You know, I was a correctional officer at the Maryland Pen, and that's when my disease started. It's a stressful place, and a lot of the correctional officers there used. I wasn't even thinking normal. I had to use because I got to go to work. And I realized that I was sick. My mother was an open person, so she told the family, you know, Joy is sick, so we have to support her. Now I realize the stress I put them under for them to see me that way. But when you're caught up in the disease, you can't see nothing but your pain. I didn't want anybody to look down on me. I didn't want to disgrace my family. So I just faked it. I figured long as I looked good and I went to work every day and so I thought, I wasn't hurting anybody. That's what I thought. The people I admired the most and still do today is my mother and my grandmother. You know, my grandmother was the wisest person I ever met. My mother was the strongest person I ever met. I was raised with my great-grandmother, my grandmother, and my mother. I got to run from person to person, getting love and everybody telling me I'm wonderful. We lived around a lot of woods and unexplored areas. I love going in the woods and finding new things to do. I had a German Shepherd. She used to come in the woods with me. I felt safe because she wasn't going to let anything happen to me. I was lost in the disease of active addiction for 30 years. I saw me. It broke my heart. I saw me. And it was the most traumatic thing that I've ever seen in my life. And I cried out to God, please. So my cry led me to a phone call. And my life just started changing drastically.
We work really hard to take away aspects of addiction that prevent proper treatment. So we work really hard to take away shame. We often fail to realize how much social circumstance impacts how people take care of themselves or how they address their health care. So it's putting together a team of people who have insight into the fact that when we take care of patients, we have to address all aspects and especially their social setting.
Now I'm a peer recovery coach at Hopkins Bayview. So I see people sick just like, I remember when sometimes, most of the time, their pain fills the room. I talk to them, I inspire, you know, and try to encourage and let them know where I come from, let them know it's possible. And the young people, I try to let them know that you don't have to waste 30 years. You can do it now.
Peer recovery coach can see someone in the emergency room, and then if that person gets admitted to the hospital, the same peer recovery coach goes up to see them wherever they are, and this fear and anxiety of being admitted in the hospital, and all of a sudden there's a familiar face of someone who I met in the emergency room, someone who knows about my addiction and is non-judgmental and understanding.
I say I'm free all the time from the disease of addiction because I'm free to choose. I didn't have a choice when I was using. And I'm free to make my dreams come true. See, I'm truly free today. You know, I'm free to love because now I'm learning how to do it because I didn't know how to before. So, I mean, it's not the sky's the limit, the sky and beyond.
The reason it can be so hard to quit opioids once someone starts is because opioid withdrawal is so intense and terrible that it actually promotes continued drug use. The change your body goes through after quitting is more intense than actually continuing the drug. Even though people are harming their body long term, the short term effects are so blistering that it is more pleasing to continue use rather than quit, even if one wants to. After only a few weeks of opioid use, withdrawal symptoms begin to hit users just 8 hours after their last dose, something that is unique to this family of drug. No other addictive substance takes hold with such ferocity. This drug takes a chokehold on your life and makes it nearly impossible to quit. It is unlike any other drug in that withdrawal symptoms start the same day you quit if you don't stop. Many people have to take multiple doses a day just to prevent symptoms from starting and continuing. It's terrible how one bad decision can have you hooked for life, and there's nearly nothing you can do about it. Overdose numbers of opioids have been climbing year after year in the U.S., with numbers reaching upwards of 80,000 in 2022, which is almost double the 50,000 number in 2019, just 3 years prior. In 2022, nearly 108,000 people died from drug overdose, with 82,000 coming from opioid death, which is an astonishing 76%. Wow. Just wow. If that doesn't put it into perspective, the strength and seriousness of taking a drug from the opioid family, I don't know what does. Opioids are everywhere, and if you're trying and experimenting with drugs, chances are you'll run into opioids at some point. This upsurge in deaths is primarily coming from the stronger drugs in the family like tramadol and fentanyl. We're going to look at a video explaining how a drug like fentanyl works in the body.
Opioids are drugs that are prescribed to treat moderately severe or severe pain. Examples of these drugs include hydrocodone, oxycodone, morphine, hydromorphone, methadone, and fentanyl. Heroin, an illegal drug, is also an opioid. In order to understand how opioids work, it's important to know how your body feels pain. The process begins when something harmful happens to your body. Information about this harm is converted to a nerve signal. The signal passes along nerves to your spinal cord and brain. In your brain, the signal is perceived as pain. Opioid drugs affect how you feel pain. They attach to structures called opioid receptors. These receptors are found on cells in your brain, spinal cord, and other areas of your body. Opioids act on these receptors to make you feel less pain. These drugs can also have other effects on your body. For example, they may give you an intense short-term high and feelings of extreme happiness. Opioids also activate the reward pathway in your brain. This causes certain parts of the reward pathway to release a chemical called dopamine. Scientists think dopamine helps you remember how good you felt while taking opioids and makes you want to keep taking them. This link between remembering things that make you feel good with a desire to do them again is an important part of developing addiction. Opioids may also slow your breathing and make you feel nauseated. And they may cause reduced motion of your intestines, resulting in constipation. For most people, when opioids are taken as prescribed for a short time, they are fairly safe and effective. But these drugs can be taken in ways that weren't prescribed, such as taking too many, taking them to get high, or giving them to someone else. Misusing these drugs can raise your risk of developing drug tolerance, dependence, addiction, and overdose. Tolerance means the drug is less effective over time. This can happen when opioid receptors become less sensitive to the effects of the drug. As a result, more of the drug needs to be taken for you to get pain relief. Dependence happens if a person has symptoms when they stop using the drug. When the drug is removed or withdrawn, you feel sick. This sickness is called withdrawal. Opioid withdrawal has flu-like symptoms that include restlessness and anxiety, muscle aches, inability to sleep, watery eyes and runny nose, nausea and vomiting, stomach cramps and diarrhea, and dilated or widened pupils. Opioid addiction is a brain disease where you have an overwhelming craving for the drug. You can't stop taking the drug despite the harm it may cause you. Addiction is not the same as dependence. You can be tolerant of a drug or dependent on a drug without being addicted to it. Finally, opioid overdose is a condition where taking too much of the drug can cause life-threatening symptoms or even death. The amount that can cause an overdose varies from person to person and even within the same individual. The symptoms of opioid overdose can include confusion, feeling very sleepy or not alert, nausea and vomiting, constricted or small pupils, unconsciousness, slow or stopped breathing, and death. According to the Centers for Disease Control, over 100 Americans die each day from opioid overdoses. If you have questions about opioids, or if you are
In recent years, fentanyl has become a massive problem in the United States, especially among collegiate students. The drug dealers and suppliers are lacing many drugs, even recreational drugs such as weed, with fentanyl, which is 50 times stronger than heroin and 100 times stronger than morphine. Due to fentanyl's high potency, it takes a very small amount of fentanyl to create the effect of analgesia, the absence of pain, or euphoria, or to help people avoid the symptoms of opioid withdrawal. The potency also presents a high risk for overdose. This is resulting in the massive overdose numbers we were just talking about. Most people don't even know they are taking fentanyl until it's too late and there's no going back. Because people don't realize just how little they can take that produce the effect, they end up taking a massive dose, and this is resulting in a fentanyl overdose epidemic. The fentanyl epidemic has become so bad that the DEA, the United States Drug Enforcement Administration, has a special exhibit called The Face of Fentanyl in remembrance of all people who lost their lives due to fentanyl poisoning. They're actively trying to raise awareness of the types of things suppliers mix in with their drugs to bring in more buyers, and thus more money. As a college student myself, it's sickening to see how many people my age are dying from this illicit drug and throwing their whole life away for a high. It's truly so upsetting and something you would only see in a movie, except it's not a movie, it's happening every day in real life. So you can be the change the world needs by just saying no. If suppliers have nobody to buy from, the drugs will go away and we can make a change in the world for the better. People, especially young adults and kids, are dying every day due to laced drugs and drugs in general, and when is enough enough? You have the power to stick up for how you feel and help influence the people around you to do the same. Don't wait for change to happen, but be the change the world needs. Say no to drugs.